Hello, everybody. This is Dr. Gita Mathai, and this is my Health Vibes channel. Today, we are going to talk about a very common problem, and that is constipation. Actually, constipation is a very common problem, but people don't like to talk about it even with their doctors because they feel embarrassed. What exactly is constipation? It is a bloated feeling in the abdomen, discomfort, but to be very precise, you have to pass motion less than 3 times a week, and in children, it's less than 2 times a week. Some people feel they are constipated even when they are not. So, if you think you're constipated, you should maintain a diary and record how many times in a week you pass motion and whether the motion is hard and there is pain and discomfort associated with passing motion. Usually constipation is temporary, but in and it lasts just for a few days or a week or so. If constipation lasts for more than 2 weeks, then it is called chronic constipation. In order for a person not to be constipated, the intestines have to propel the motion up to the rectum. But there may be some obstruction like a tumor along the way. It doesn't necessarily have to be cancer. It may even be a pregnant uterus which is pressing on the intestines and preventing the motion from being passed freely. The proper forward propulsion of the motion is also dependent on the nerves supplying the intestine. So, if you have any disease of the nerves like Parkinson's disease, or the nerves are affected because of diabetes or hypothyroidism, then also there may be chronic constipation. Sometimes the constipation may be due to medicines like antidepressants or antihistamines. In children, the constipation may be due to a disease called Hirschsprung's disease or cystic fibrosis. Sometimes children get constipated because they have developed fissures near the rectum and anus, which are very painful. So even when they feel like passing motion, they hold in the motion, and since nobody has noticed the fissures, people just feel that their children are constipated. Why are people so very particular about constipation? There are myths. In the olden days, people were told that if you are constipated, then poisons and toxins are absorbed from this motion, which is stuck in your body, and you will get diseases like hypertension and diabetes and cancer. But this is not true, it is just a myth. Supposing constipation appears suddenly, lasts for more than 2 weeks, and is associated with loss of weight or bleeding from the rectum, then it has to be taken very seriously and evaluated because it may be because of a tumor. In order to treat constipation, first of all, your habits should be regular and you should have a regular fixed time to go and sit in the toilet. And this should be inculcated in children from a very young age. Secondly, people may not drink enough fluids. Fluid is needed to propel the motion forward, and also fluids are absorbed in the rectum. So if you don't drink enough fluid, the motion will become very hard and then it will be difficult to pass. Adults need to eat 4 to 6 helpings of fruits and vegetables a day in order to provide fiber to the diet, because fiber bulks up the motion and enables it to be passed freely. Children also need to be fed fruits and vegetables and not just given fast food and lace and chips to eat. Milk is constipating. After the age of 1, not more than 400 ml of milk should be given per day. Otherwise, the milk itself will cause constipation. If sufficient fiber is not eaten, it can be taken in the form of ipsagol husk, which is a non-absorbed form of fiber and can be eaten safely in order to prevent constipation. A lot of people take laxatives, and the laxatives may they may take so much of laxatives that they actually have diarrhea. Laxatives have a bad name, and people think that they will get habituated to it and have to take larger and larger doses for the same effect. This is not true. Unless you take more than 30 times the recommended doses, there will not be side effects even if you do use laxatives regularly. They will make your life easier. So remember, most of the time, constipation, if it lasts for less than 2 weeks and is caused by a temporary phenomenon like travel, change in diet, change of place, or change in habits, it can be tackled by drinking fluids, bulking up the diet, and trying to establish a regular routine. Also, Please remember that if your abdominal muscles are lax, then it will not propel the motions out. So you need to do exercise in order to have a good core and tight abdominal muscles. Everybody stay fit, stay happy, and keep everybody around you healthy and happy. This is Dr. Gita Mathai signing off. This is my Health Vibes channel. If you liked what you heard, please subscribe to my channel and press the bell button. The same content is available in Tamil. Thank you.